Welcome, everyone. This is Lessons from the Field, and this is a interview series where we bring in guests who have a common passion for pharmacy and pharmaceutical sciences. And today we're featuring Dr. Alexandra Broadus, who is a graduate from 2008, our PharmD program. And Alex is now a senior director for specialty health solutions with Walgreens Corporation, and she's been with Walgreens for her entire career, and we're really looking forward to hearing about that, Alex, and some of your advice as we have many students who are interested in a career like that. So we're going to ask Alex a series of questions. Those questions will elucidate insight from her on her career and experiences for the benefit of our students, alumni, and friends who might be listening. So let's go ahead and get started, Alex. If you could just maybe give us a brief walkthrough of your career or what you've done since you graduated in 2008.
Yeah, sure. I'd love to. So I had worked for Walgreens throughout school. So I was very fortunate to be a pharmacy intern for Walgreens while I was at COP. And when I graduated, I moved out to New York and started working as a pharmacy manager out there. And then shortly after that, I became part of field supervision, or field leadership is what we call it. And so I took on that role beginning in the DC metro area and then moving back up into Connecticut. And it was really cool when I moved back up to Connecticut because that's when I started working with specialty health. We had over a dozen specialty pharmacies in the Connecticut area that I helped to support, including those serving FQHC communities, so underserved communities, as well as those at Yale, New Haven Medical Center, and many other medical centers in the region. So because of that, I really got to know about both sides of care in our communities, both at our standard traditional community sites and the retail pharmacies, as they're often called, as well as our specialty pharmacies. And from there, I took on a regional healthcare director position based out of Ohio that served Ohio, parts of Indiana, parts of Kentucky, the Pittsburgh area, and a little bit of Michigan. And so that was really an incredible experience for me because growing up, I grew up in the Chicago suburbs. So I had heard about the Rust Belt, but I didn't really understand anything about the Rust Belt or Middle America and what different barriers those patients face. So it was really important and formative experience for me, working both with patients and our team members in those communities, as well as with the health plans and payers trying to serve those communities. And shortly after that, I went on special assignment up at our support office with a focus on our adherence programs and really did a deep dive into pay for performance and value-based reimbursement. I'm sure many of you have heard about DER fees, so really dug in on what our strategy was to improve outcomes and minimize our risk with DER fees. Went back out to the field and then joined the support office permanently in a role focused on patient outcomes improvement as a director. And just 2 or 3 weeks ago, was promoted into my new role as the specialty director of, or senior director rather, of specialty health solutions. So both of my last roles at the support office were focused on developing, designing, and implementing new clinical products and services to improve patient outcomes. Before it was more on our traditional chronic conditions like diabetes, cholesterol, hypertension, asthma, COPD, and now more of a focus on our specialty conditions like CID, MS, oncology, and HIV. So very blessed to be doing really incredible work to improve outcomes for the patients in our communities. Very rewarding.
Wow. I mean, I think in 12 years and the opportunities you've had to live in different places across the country and all of the experience that you got in that time, it's really incredible. It kind of shows, I think, you know, for those who are still in our program or recent graduates, just the kind of opportunities that you can get when you're working for a corporation like Walgreens.
One of the most important things in my career has been working and getting that diversity of experience with different cultures and communities. And that's actually something that started with COP, because I was really fortunate to do all these different clinical rotations, whether it was underserved communities and patient populations where patients were really in need, or even with some of my clinical rotations, really affluent communities. And so that gave me a really good lens that in order to be a good practitioner, you really need to understand the type of community you're serving, as well as the fact that there's a lot of different communities out there to serve.
Well, I'm so happy you said that. It's obviously one of the things that we take pride in at UIC, and is our diversity and, the different communities that we place our students in for experiential rotations, and just the breadth of those kinds of cultural and experiential things that come up when you're in our program. But maybe I can skip to the question that I was going to ask you, and just, are there other things about your time at UIC that help prepare you for this great kind of career that you've had so far?
Yeah, absolutely. So I think there's a couple things. We were talking a bit before we started the interview how I really enjoyed some of the more administrative rotations as well as classes that I had while I was at UIC. And I think that helped prepare me to have at least an entry-level business acumen that was really helpful when I entered into the pharmacy practice as a professional, because whether it's managing a pharmacy and being able to manage your inventory, or being able to coach and train your team members to drive business results, or now in my current role, managing multi-million-dollar P&Ls, you need to understand those basic principles of economics and business savvy and all those things. So that was really helpful at UIC. And then on the flip side of that, we talked a bit about how the different experiential rotations really give you a good breadth and depth of knowledge for different patient types. But I do think that UIC had a unique focus on health equity before health equity was trendy to talk about, and also a really big focus on public health in general. And so I truly do feel that focus really became ingrained in me and has made me, throughout my career, a very patient-centric practitioner, both in practice as well as in a corporate setting, where I'm always trying to think about, at the end of this, how is this going to help improve outcomes for our patients? How will this impact patients with low health literacy? How can we make it simple for our team members and our pharmacists to be able to explain this to patients with low health literacy? And what tools do they need to be able to do that? So those, I would say, are two of the things that I'm most proud to have taken away from being a COP student.
Well, that's excellent. There's so much that you said there that I want to repeat for all of our students, including including your your reflection on kind of the administrative courses and what you learned there and how important that's been in your career. I think a lot of times students in the moment maybe don't appreciate that as much, and then of course when they're out, like your experience suggests, they recognize that some of that really is important and helpful. And then the focus on the clinical and the patient is something that I think UIC's prided itself on over many years. But we also, there's been times where I think criticized in a little way that, especially in community pharmacy, that maybe we are overdoing it. But what you said and what I think is true is that all of us really should be clinical pharmacists. And if we focus on the patient and what's best for the patient and those clinical things, I think that, regardless of the setting, that's really what's the most important. So thank you. That was awesome. So you've been out 12 years, you've crisscrossed the country, met all kinds of people, worked with many different pharmacists and patients. What are you most proud of in that time? Or what are the things that have given you the most satisfaction maybe so far?
Yeah, I have to say one of the things I'm most proud of is the fact that through the last 2 years or so, I've really been able to spearhead a lot of our clinical programs at Walgreens. And so I'll give you an example that will really kind of illustrate, I think, my point of pride. When I first went into my role, I had to explain to some executive leaders, like, what is a HEDIS measure and how can pharmacists actually impact a HEDIS measure? It's a health plan measure. What does this have to do with us? So really had to explain this and educate people. And now, fast forward 2.5 years, every time I see our pharmacists or technicians talking in our internal communications or when they're talking to the media, our pharmacy team members are talking about how the work they do is helping to improve health outcomes in their communities. And so just being able to have been a part of that change journey the last 2 years to bring that clinical part of pharmacy to the forefront of how we practice pharmacy in community is definitely, I think, something that I'm most proud of. I like to think that when I'm 80 and rocking on a porch somewhere, I'm going to look back and I'm going to be like, wow, I was part of helping change the way the world perceives how pharmacists practice pharmacy.
Yeah.
So that is what I'm proud of.
Well, that is definitely something to be proud of. And again, I think I kind of reflect back on UIC and all of the work we really do with our students to understand outcomes. We have a great group, obviously, of faculty in that area.
Mm-hmm.
So it's nice to see some of that translate to the students and then what you do in your career. So that's really awesome. So now maybe we could kind of turn the tables a little bit and ask you, for our students who are considering, what they want to do when they finish school, these days they have to think about this so far in advance because things are so competitive, and whether they're going to do a residency, fellowship, or go right into a position. What advice would you have for a student in pharmacy right now in terms of best ways they can prepare for a career like you've had?
What I would say is I think maybe a shift in perception. So if you'll bear with me here for a minute, or maybe the generation before the generation I was in when I graduated pharmacy, there were really only two options. I am amplifying a bit, but you could either be a hospital pharmacist or you could be a pharmacist in the community. And those were your only options. And people made career choices because they did or didn't like talking to patients, essentially, or, so very silly things. And then fast forward to when I graduated just over 12 years ago, we started to have more options. Residencies became more important. Pharma was more interested in hiring pharmacists. There were more non-traditional career paths, but the majority of people still went into either hospital or community pharmacies. Now, where I see pharmacy going is I see that you have a very diverse range of options for you in your long-term career. And wherever you set out after graduation, whether it's a residency, a hospital, or a community pharmacy, or something else altogether, you really should view that as more of your entry-level job, right? The job where you're going to just learn your basic skills of how to take care of patients, how to talk to patients, how to identify what patients' problems are. And then from there, you can really figure out what it is that you want to do long term. Do you want to be an entrepreneur in the healthcare space? Do you want to go work for a health plan? Do you want to do what I do, which is clinical product development? I never thought I wanted to do clinical product development, but that's kind of what my journey was. I went into an entry-level role. I knew I wanted to influence the way that people provided care for patients. I didn't want to just accept the status quo at community pharmacy, so I went into field leadership. And from there, I wanted to make a bigger impact, and the only bigger impact I could make was building the programs themselves. So I would just encourage people to think about whatever step that they take next after graduation. It's just your first step. It's an entry-level job like any other college graduate would get, and you need to learn certain skills in that job, but also be thinking about what do you want to do 2 jobs from now? What brings you joy? What brings you passion? Is it technology? Is it having a flexible work schedule? Is it utilization management? Is it IT and data management and going into EMRs? You can do so much with your degree. You really don't have to limit yourself to the traditional path that we've had. Although I will say I miss every day being on the bench. I really do. I miss talking to patients. And so I would happily be a pharmacist in the community again if things changed up in my life. It's a tremendous job and has a huge impact on our patients.
Great advice. Yeah, I think too often, students are in a hurry to kind of get to the end, and they forget that you have a whole career ahead of you. You have plenty of time to accomplish what you want to accomplish. So make sure you get the groundwork in that first position or second position and build your portfolio, your experiences, and that'll bring you closer to what your goal. So that's great advice. Thank you, Alex. So you're, like you said, just past your 12th year since graduation. And you've mentioned some of the things I think that excite you about pharmacy or bring you passion in your position. Maybe you could elaborate on that, and also look into the future. What do you see either you doing or the pharmacy field in general?
So I'll start with where do I see things going, because it's a lot about what I try to do, and actually ties back to something you said earlier about your team at COP, who focuses on measuring outcomes and outcomes-based research. So this is kind of the catch-22 of community pharmacy in particular, is that we've always done a ton of work to take care of our patients, a ton of it. I mean, I can think about everything that I did when I was a pharmacist, how many ER visits I helped avoid, how many hospitalizations I helped to avoid, but we never documented any of it. We never got paid for any of it. And nobody believes we can do any of it because we just don't have the studies to show that we can. So I think now, particularly in this post-COVID environment, the realization is that the healthcare system is really strained, and we need more resources to be able to help manage these really complex conditions. One of my favorite stats is one that a high-risk Medicaid patient sees their pharmacist over 36 times a year, and they see their practitioner only 4 times, I think it is. I can't remember the exact stat on the top of my head. But in any case, I know that health plans know that pharmacists have trusted relationships with their patients, that their patients listen to them, that oftentimes pharmacists are more equipped to overcome cultural or language barriers than other healthcare providers. And they know that they see them a lot. So I think what we'll see pharmacists playing more of a role in prescriptive authority. That's already happening now, and I'm very proud with the very proactive stance that Walgreens is taking from a policy perspective to move that forward. I think pharmacists will begin to play a broader role in health testing. We're seeing that with COVID, but we were already seeing signs of that, because just making sure that patients' A1Cs are checked regularly is a huge challenge. Getting quarterly HIV tests done so patients can be on PrEP, huge challenge. So pharmacists and pharmacies can help fill that void. And I do believe that pharmacists will take a larger role in disease state management in general, particularly of chronic health conditions like diabetes and hypertension. So what I think, or maybe what I wish for, I wished for the same thing when I left COP in 2008, is that you'll see the type of care provided by pharmacists at COPs, ambulatory centers, in partnership with physicians and other care providers, you'll see that starting to come to life in retail pharmacy as well. And that will have a tremendous impact on the profession of pharmacy, and I think will have a lot of ripple effects across the pharmacy profession in general. I think in parallel to that, we'll have to start figuring out how do we give away some of the more administrative tasks in the same way that prescribers had to do the same thing, right? I can't remember the last time a doctor gave somebody an immunization, for example, right? So how do we start to transition away some of those administrative burdens or less professional tasks, and so we can focus more on how we can really drive improved outcomes. But then to my earlier point, we have to get paid for them, and we have to measure them and demonstrate that we can do those things. So that's the part of my work that I'm most proud of doing, is not just developing the programs, but working with partners to measure the success of those programs and publish results, and also advocating for fair reimbursement of pharmacists for clinical services.
Excellent. I mean, that's a great vision, obviously, for the profession, and I think bodes well for our students and what they can do into the future. I mean, sometimes I think, with the number of new schools and number of pharmacists graduate and some of the changes in the profession, there's been times where it's been a little bit hard to see, what the opportunities are sometimes, I think, for students who are in school. But as you're describing it, there'll be so many new opportunities for pharmacists. And I really believe that your vision of that is very accurate, and is where we're going to be going in the future. So thank you. Over your career, whether it was in school or since then, you've worked with a lot of different people. Are there particular people or experiences that you've had, or advice that you've gotten from people that's really informed you the most or influenced you the most as you've moved forward?
So I'll share one piece of advice and then quickly talk about one person that we all know. So one piece of advice that I got when I was 7 months pregnant, and I was hesitating to apply for a promotion, to apply to be a regional healthcare director. At the time, Paul Zagami, my regional vice president, told me, he said, "Alex, if you were pregnant but your husband was applying to the job, would you tell him not to apply to the job because you guys were about to have a baby?" And I said, "No, of course I wouldn't." And he said, "Well, then you should apply to the job." So I say that because it's good advice, whether it's having kids or whether it's going through any other life change, like having to contemplate a move or whatnot. You should always make the right decision for you, but don't let your preconceived notions get in your head of what you should or shouldn't do. And if you want to do something, take the risk and do it. So really good advice that's stuck with me since in my career. And then in terms of people that have influenced me, there's so many, but I do want to say, Rena Shaw, who I've worked with the last 2 years or so, has been such a tremendous voice for a pharmacy profession in general. And I think people will be shocked by how much she works behind the scenes to keep advancing our profession and moving it forward, and really passionate about patient care. So seeing that on top of everything else that she has to do has been really inspiring to me. So, I mean, you guys have some pretty good odds here with COP grads. You got some good people.
You're right, we do. Anybody listening who doesn't know Rena Shaw, she's a top executive at Walgreens and a grad of our program, and actually was our keynote speaker for graduation last spring, and did a great job. It was, of course, virtual, our first ever, but just fantastic and great leader in pharmacy. And thank you for bringing her into this, because She has done a lot, and so tied with Walgreens and UIC. Alex, this has been a lot of fun. Thank you so much for doing this. I think your advice for our students and reflections on your experience and on the profession is, really spot on. And you're a great role model for what I think a lot of our students would see as a perfect career. So thank you. Is there any last minute or any additional comments you'd like to make for our students or anyone else who's listening?
No, just that if anybody ever needs anything, feel free to reach out to me. You can get me on LinkedIn or you can email me. My full name at walgreens.com, but I'm always here to talk to any COP students, and make sure to take advantage of the fact that you're a student. Pretty much anybody will give you 15 minutes of their time. So,
well, thank you for that. I mean, that's so true and so important, actually. And we've been stressing that with our students repeatedly, that, you really do need to reach out, make those connections, and those connections can pay off in so many ways over the short term and long term. So again,
absolutely.
Alex, it was great seeing you again, and we're really proud of what you've done since you left here. And thanks for taking time to give back a little bit to the college and to our students by doing this interview.
Thank you so much for having me. I appreciate it.